Hello everyone, welcome to my channel Dentistry Made Easy. The topic for today is removable partial dentures from prosthodontics. Now what is prosthodontics? Prosthodontics is nothing but when you're replacing the missing teeth, this is known as prosthodontics. When you're replacing your missing teeth with some artificial substitutes, those artificial teeth. And prosthodontic is broadly classified into three types, that is removable, fixed and implants. Fixed are those which gets fixed into your mouth. Removable are those like the patient they can remove and wear those dentures. And implants uh, are the branch of prosthodontics in which screws are embedded into the bone. Now, removable dentures, they are again classified into two types, complete and partial. Complete is when you don't have a single teeth in your mouth, so you're completely, like you're making a denture, you're making a complete denture. And partial are when there are some teeth that are missing in the mouth and some teeth are naturally present. And I am covering the removable partial denture in this topic before the complete denture because in final year we are doing patients for complete dentures. So I'm going to cover first removable partial denture like completely in broad, and then I'm going to cover removable complete dentures too, like all the main topics for that uh, topic. Moving into the video, removable partial dentures. They are any prosthesis that replaces some teeth in a partially dented arch. It can be removed from the mouth and replaced at will. It is also called as partial removable dental prosthesis. Now, as per the definition, it says it is a prosthesis that replaces some teeth because it is partial. So it replaces some teeth. Then it is removed from the mouth and it is replaced at will. Like patient can remove it and patient can wear it whenever they want. So now you can see over here, this is your removable partial denture. These are the remaining natural teeth. Over here, the teeth are missing. So this is removable partial dentures. Like over here, as you can see, this is the cast which is poured of the patient. Over here, these are the natural teeth which are present, and this is the removable partial denture. Now, removable partial dentures, they are of two types, acrylic partial and cast partial. Acrylic because they are made up of acrylic. Now over here, these two, they are acrylic. They are made up of acrylic material. This pink color material is called acrylic, and they're also known as flippers as they are entirely tissue supported. They are tissue supported and they causes gingival recession. They recede your gingiva and hence they are named as gum strippers, and because of that they are not mostly used because they causes gingival recession. But cast partial dentures are named because of the material that they are made up of. They are made up of the lost wax casting procedure. This is the casting procedure which we are like taught in our second years. What is casting procedure? So these two are the types of removable partial dentures. Now, what are the indications and contraindications of removable partial dentures? Indications are those like when you should use your dentures, when you should use RPDs, and contraindications are those like when you shouldn't use these RPDs. So, first indication is length of edentulous span. Now, removable partial dentures are preferred for a long span edentulous spaces because the denture base it aids to distribute forces all along the edentulous portion of the ridge. Now, for example, if the arch it has 3 to 4 missing teeth, so over there you should use removable partial dentures rather than fixed partial dentures. Fixed partial dentures can be used when you have single missing tooth. So over there you can use fixed partial dentures, but for removable partial dentures, when the length of the denture span is long, so you can use removable partial dentures. Why? Because removable partial dentures they take support from the tissues all along the ridge, and they also distribute the forces around the ridge evenly, whereas fixed partial denture it they produces excessive force on the abutment teeth. Now as you can see over here, now this is the Antis law. Antis law is followed, it is used in fixed partial dentures. Antis law it says that the pericemmental surface area of the abutment teeth to be used for a fixed partial denture must be equal to or exceed the pericemmental surface area of the teeth being replaced. Now as you can see, these two are the missing teeth and you have to replace them. These are the teeth adjacent to them. So the surface area of these teeth it should be more or equal to these teeth. The surface areas now as in fixed partial dentures, The fixed partial dentures, they take support from their abutment. So the abutment should be like too strong to give them proper support. And this Anti's law, it is properly explained in fixed partial dentures, which I'm going to do when I'm going to complete my portion for the fixed partial dentures. So the first is the length of edentulous span, and it is preferred for a longer edentulous areas. Then age. In patient under the age of 17, a fixed partial denture is contraindicated because they have large dental pulp and lack sufficient clinical crown length. In fixed partial dentures, the abutment teeth are reduced so that the prosthesis can be fabricated like a cap. Now you know that bridges. Like what we are doing is when a single teeth, suppose this is a single teeth that you have to replace, then what you do for the fixed partial dentures, you're even reducing these teeth, and even you are reducing these teeth to get the support from, these are the abutment in fixed partial dentures. You reduce both the teeth and you make a cap out of it. So there are these three bridge, so it causes a bridge, so it makes a bridge. And when the patient is below 17 years, so what happen is your pulp horn, they are like, they have large pulp horns, dental pulp, and because of that it can cause sensitivity. And when we are reducing, when we are doing our crown cutting, so that time the pulp can be exposed, so it is not indicated when the patient is below 17 years. So it is not so it is not indicated. And so fixed partial dentures is not indicated, rather we are using remover partial dentures. And in old age, the reduce, and the first age indication is when the patient is below 17 years, and the second indication is in the old age, because there is reduced life expectancy, and frequently failing health contraindicates the use of expensive. When you are comparing the price for fixed and removable are obviously, they are inexpensive, they are like, they cost less than the fixed partial dentures. So when the patient is a old age patient, so that time we are indicating a RPD. Now the abutment teeth, fixed partial dentures can only be used if the posterior tooth for support. Now as you can see, fixed partial dentures, like if you're fabricating a fixed partial denture onto this tooth, so what happen is you need abutment on the both side. It's not like the teeth is absent over here and you can make a fixed partial denture. That's not possible. So you need a posterior teeth always. So when there is no posterior teeth behind, when there is no teeth present behind over that time, like at that time you can use remover partial dentures. When there is no teeth posterior to the dentular space to act as an abutment, a remover partial denture is preferred. And there is a exception, that is cantilever fixed partial denture. And the fourth one is periodontal support of the remaining teeth. The periodontal membrane is the structure which transfers all the load from the teeth to the underlying bone. So your periodontal membrane, this periodontal membrane, it transfers all the load, like all the forces, to the underlying bone. When the periodontal support of the remaining teeth is poor, a fixed partial denture is contraindicated and a removal partial denture is preferred because it requires less support from the abutment teeth. Like as I said, uh, for the length, it evenly distribute the forces along the ridge. And for the fixed, you need a proper abutment. Abutment tooth is nothing but the uh, natural teeth which are present adjacent to your missing teeth. So they act as an abutment, like they give support to your artificial teeth. So if the periodontal, in periodontal support, if your periodontal status of the abutment is weak, so you cannot make a fixed partial dentures. At that time, you can use this removal partial dentures. Now, as you can see over here, this is a tooth which distributes the force onto a surrounding alveolar bone, like it evenly distributes. A periodontally weak tooth will not successfully transmit the forces to the alveolar bone. Now, now as you can see over here, this tooth, it has a periodontal problems. So at that time, they cannot transmit the forces to the alveolar bone. Now, when a removal partial denture base, it concentrates the load to the tissue receiving the abutment from the excessive stress. Now, when you are making a removal partial dentures, it again gets the support from all over the ridge and everything, and because of that you can use removal partial dentures. Now what is cross arch stabilization? The fifth indication is cross arch stabilization. When the remaining teeth have to be stabilized against the lateral and the anterior-posterior forces, a removal partial dentures is indicated. A fixed partial dentures will provide only anterior-posterior stabilization, and they have limited lateral or buccolingual stabilization. The major connector, it helps to provide cross-arch stabilization. So this is the cross-arch stabilization. Like when you're making a removal partial denture, it helps in stabilizing in both the directions, like anterior posteriorly and buccolingually. So this is buccolingually and anterior posteriorly. It stabilizes in both the direction, but when you're making a fixed partial denture, it only has a anterior posterior stabilization, but that is there is lateral or buccolingual limited stabilization. And this process stabilization is done by the major connectors which are present in this removal partial dentures. Now the sixth indication is excessive bone loss. Excessive bone loss is when there is a trauma or excessive residual ridge resorption. When there is more bone loss, it is difficult to place the artificial teeth of the fixed partial denture in an ideal position. In a removable partial denture, the artificial tooth can be positioned as per the operator's preference, and the denture base can be fabricated to provide the required support and aesthetic. So this is the when there is excessive bone loss, so you are using removal partial dentures. Then aesthetics. Aesthetics is removal partial denture. They provide better aesthetics because the denture base, it gives the appearance of a natural tooth arising from the gingiva. The partial denture teeth have more lifelike appearance than pontic that appears dull and flat. Like your fixed partial dentures, they appear dull and flat, and remote partial dentures, they give more lifelike appearance over here. As you can see, you can make the denture as you want. The acrylic portion you can make as you want, and because of that, it provides more aesthetics. Then the eighth one is immediate teeth replacement after extraction. It is not successful in the case of fixed partial dentures because further ridge resorption will occur and it produces an unesthetic appearance. In a case of removed partial denture, relining can be done as resorption occurs. Now, what happens is fixed is like you're fixing it, and remove is when you can easily remove it. If the patient like if the patient requires immediate teeth replacement, so over there you can suggest removal partial dentures. Like you're preferring removal partial dentures because what happens is like you can after the bone gets resorbed because of the denture, what happens is you can change the like you can make changes onto the denture for removal partial dentures, but you cannot do the same for fixed partial dentures. So after immediate like when a patient requires immediate teeth replacement, at that time you are preferring removal partial dentures. Then the emotional problems. In case with physical and emotional problems, expensive and tedious dental procedures required for the fabrication of fixed partial dentures are best avoided. The appointment for the removal partial denture is shorter and they are less demanding to the patient. Now, emotional problems is when uh, the appointment, like the appointment for removal partial denture are shorter, but for fixed partial dentures they are even expensive, they require more time, and when people have many problems related to like their emotions, so over that time rpds are best preferred. And last was patient's desire. When the patient wants removal partial denture, they do not want fixed partial dentures. Like some patients come and they say we want removal, like we want the dentures to be removed when we want. So this can there can be two scenarios to avoid operative procedure on sound healthy teeth. Like in fixed partial denture, what you're doing is you're even reducing, you're doing crown cutting for the adjacent sound teeth. So that is there is one thing like patient says we don't want a sound teeth to be destroyed or like any procedure to be done on those teeth. So they ask for removal partial dentures, and the other reason is for economic reasons, as fixed partial dentures is expensive. So people are preferring more towards RPDs, towards removal partial dentures. Then what are the contraindications? Contraindications first is epileptic patient. In epileptic patient, there are chances of swallowing the dentures because when they are getting epileptic attacks, so there are chances that they can swallow the denture. So it is not indicated in epileptic patient. Then patients with large tongue, because what happens is they tend to push the denture away. Patients who are having larger tongue, they push the denture away. Then mental attitude is when a patient is mentally retarded, he cannot maintain a removed partial dentures. And when a patient is having poor oral hygiene, because maintaining a removed partial denture is itself a very hard work, because you need to maintain good oral hygiene to maintain removal partial dentures. So this is again a contraindication. So these are the contraindications and indications for removal partial dentures. Now this is a very important part of removal partial dentures, like how you're classifying your arches. There were like more than 50 classifications which were given to classify the edentulous arches, but the Kennedy's classification was the most popular one, and even we are using it today also. So the first one, which it was given by Kumar, like it has its drawbacks. So because of that, it wasn't accepted. Like it is not accepted more. Then the Kennedy's classification, it was the second classification which was developed in the year 1923. So this is the most popular classification. He classified partially edentulous arches and not the dentures. Kennedy, he classified the edentulous spaces rather than he classifying the dentures, which was done by Kumar. So for the Kennedy's classification, it is divided into four classes. So class 1 is when there is bilateral edentulous area located posterior to the remaining natural teeth. That is, there are two edentulous spaces located in the posterior region without any teeth posterior to it. Now what does that mean? So class 1 is when there is bilateral edentulous area. Bilateral is on the both sides. So this is a maxilla, upper jaw, on the both side. Like this is your midline. When you have edentulous area on both the sides, so that means bilateral edentulous area in which is located posterior to the remaining natural teeth. Now it means remaining natural teeth are your natural teeth, like the remaining teeth. So the edentulous area, it is located posterior to it and bilaterally on the both sides. So that is class 1, which means there are two edentulous spaces, one here and one here. On both the side there are edentulous space, and it is located posteriorly, like there are no teeth posterior to your edentulous area. It is the most posterior edentulous area. Now class 2 is when it is unilateral. Again it is same like class 1, but the only difference is it is unilateral. It is only on the one side. Now over here you can see this all are the natural remaining natural teeth. For class 1, as you can see, it is bilaterally on both the sides. It is edentulous, but in class 2 only on one side it is edentulous, whether it is maxillary right side, maxillary left side, any one side is edentulous, and most posteriorly, like there are no teeth posterior to your edentulous area. So this is class 2. Class 1 is bilateral edentulous area located posterior to the remaining natural teeth, and class 2 is unilateral edentulous area located posterior to the remaining natural teeth. Now what is 3? Class 3 is unilateral edentulous area. Again, unilateral is on one side with natural teeth anterior and posterior to it. That is, it indicates a single edentulous area which does not crosses the midline of the arch with teeth present on both the side. Now, the class 3 is when you have remaining natural teeth anteriorly and posteriorly. The edentulous area, it is between the remaining natural teeth and it is unilateral. It does not crosses your midline. Now this is your midline. So it does not crosses the midline and it is present between two natural teeth. So that is your class 3. And class 4 is a single bilateral edentulous area located anterior to the remaining natural teeth. Now over here you can see this is class 4. As in class 1 and class 2, they were present posterior to the remaining natural teeth, and in class 4 it is present anterior to the remaining natural teeth. Now these are your remaining natural teeth, and over here this is your class 4 and it crosses the midline. When, for example, if there is a tooth over here, like you have a central incisor over here, and this is your edentulous area, so it becomes your class 3. When the edentulous area, it crosses the midline, that means your class 4, or else it is class 3 if it is not crossing the midline. I hope you understood the Kennedy's classification. It has 4 classes. First one was when there is bilateral on both the side, There is bilateral edentulous area in which the edentulous area was posterior to the remaining natural teeth. Class 2 is when it is unilateral. Class 3 is unilateral edentulous area in which teeth are present anteriorly and posteriorly, and the edentulous area is between them and does not crosses the midline. When till here, if you have your edentulous area, then it is class 3. But when your edentulous area, it crosses this midline, that becomes your class 4. These are the main four classification, like main four classes of Kennedy's classification. Now Applegate, he modified this classification, the Kennedy's classification, in 1960, and he added two more classes, class 5 and class 6. He modified the classification based on the condition of the abutment to include two more additional groups, depending upon how your abutment is, like how your adjacent teeth are. So depending upon that, Applegate's, he modified the classification. So class 5 is the dentulous area. It is bounded anteriorly and posteriorly by natural remaining teeth in which the anterior abutment is not suitable for support. It is basically a class 3 situation. Like what happens in class 5 and class 6, it is a class 3 situation when teeth are present anteriorly and posteriorly to it. The dentulous area is between remaining natural teeth. In class 5, what happens is when your abutment, anterior abutment is weak, like it cannot give the support, so that is class 5. And class 6 is when your abutment, when the teeth are so strong that you do not need that tissue support, and that means your class 6. Like class 6 is edentulous area in which the teeth adjacent to the space are capable of the total support of the required prosthesis. This denture, it hardly requires any tissue support. Now as you can see, this class 6 is class 3 plus strong abutments, you do not require tissue support. And in class 5, class 3 plus weak abutment, like now you require more tissue abutment, like more tissue support over here. Your anterior abutment is too weak to handle that prosthesis. So this was the modification which was given by Applegate in 1960. Now Applegate, he gave several rules. There were 8 rules which was given by Applegate. The following should be considered to classify partially edentulous arches based on the Kennedy's classification. And extraction should be done prior to the classification. If any teeth is to be extracted, then it is done before the classification. Before we are determining the classification, the extraction should be done, and after that we are doing the classification. So rule number 1 was classification should always follow rather than precede extraction, because it might alter the original classification. Now as it is shown in this diagram. Now if these teeth are to be removed, like they have some problems, they are periodontally weak, or like they have deep caries or anything, and they are to be extracted, and this is your edentulous area. Now according to this, if these teeth are not extracted before the classification but they need to be extracted, so this, it turns out to be class 3, right? Because teeth over here are present, and this edentulous area, it is between the natural teeth, so it turns out to be class 3 according to the Kennedy's classification. But what you're doing is when you're removing these teeth, so what happens is now this area, it becomes edentulous, and Applegate, he gave the rule that the most edentulous area, it determines the classification. So if these teeth are removed and after that you are stating it as class 3 because you have done the diagnosis before the extraction, so this is the wrong diagnosis. So the rule number 1 is classification should always follow rather than precede extraction. Classification is done always after the extraction. When every teeth which is to be extracted are extracted, after that only you're doing the classification. Then rule 2 is if third molar is missing and not to be replaced, it is not considered in the classification. Rule 2 is, suppose if the last molar, if your third molar is missing, like it hasn't erupted and it is not to be replaced, it is not considered in the classification. If it is missing for any reason, so it is not considered in the classification. Rule 3 is if third molar is present and is used to be as an abutment, it is considered in the classification. Now over here in this scenario, your first and second molar are missing and your third molar is present, and we are going to use it as an abutment, then only it is considered in the classification, or else it is not. So that are the 3 rules which were given by Applegates. Moving towards the rule 4. Rule 4 is if the second molar is missing and not to be replaced, it is not considered in the classification. As rule 3 says that as rule 2 was if third molar is missing and not to be replaced, it is not. So rule 4 is if second molar is missing, like if your second molar is missing and it is not to be replaced, it is not considered in the classification. Then rule 5 is the most posterior edentulous area or areas always determine the classification. Now, for example, as you can see over here, this red color are the edentulous spaces. Now, over here, this is the edentulous area, and over here, these two are the edentulous area. So, according to rule 5, the most posterior edentulous area, it determines the classification. So, this is class 1. As we have said, it is bilateral edentulous area. So, the most posterior edentulous area will determine your classification. You won't say this is class 3 or class 4 and class 1. Not like that. It can be class 4 over here, and this is class 1. Like this is class 1 and this is class 4. But you're not stating it as two classification. You're just stating it as one class, and the most posterior dangerous area states your classification. So over here, it determines the classification. Then rule number 6 is edentulous area other than those which determine the classification are referred to as modification spaces and are designated by their numbers. Now, for example, the most posterior over here, this is the most posterior, this is the anterior one. So over here, this is the most posterior. This turns out to be class 3, like anterior and posterior natural teeth are present, and this is the most posterior. This is the anterior, and this is class 4. So as rule number 5, it states the most posterior area, it determines the classification. So this is class 3, and according to rule number 6, the other edentulous area are designated by the number as a modification spaces. So this is class 4, which is a modification. So you write it as class 3 modification 1 because only one edentulous space is missing. For example, if this is class 3 and over here there is edentulous area, over here there is also edentulous area, so you'll designate it as class 3 modification 2. Okay. So rule number 7 is the extent of the modification is not considered. Only the number of additional edentulous area is considered. Like you're not determining the extent of the modification. You're not considering like how many teeth are absent in those modification. Like for example, over here all the anteriors are missing, so you won't say like if the modification can be 6. No, you're just stating the area but not how many teeth are missing. How many teeth are missing is not the issue over here. Like how many edentulous areas present is rule number 7. So only the extent of the modification is not considered. Only the number of additional edentulous area is considered. And rule number 8 is there are no modification for class 4 because any additional edentulous space will definitely be posterior to it. Now, as in class 4 is always anteriorly present, so there can be no modification to it because class 4 can be a modification, but it cannot have any other modifications because all the other edentulous spaces which are present are always posterior to it. So there are no modification for class 4. Now, for example, now we'll say this is now over here as you can see. Now again, this are the scenario of two class 2s, class 3s. Over here also this is class 2, over here also this is class 3. So this is class 3 modification 1. Only the additional edentulous area is considered. Now you can see over here this is class 3 again, and there are two edentulous area. So this is class 3 modification 2 because there are two edentulous areas. Over here 1 and over here 1. This is whole 1 because there are no teeth in between present. And over here as you can see this is a teeth which is present. So it turns out to be class 3 over here, class 3 over here, and class 3 over here. So class 3 modification 2, class 3 modification 1. For example, this A diagram, it shows this is now unilateral edentulous area. So this turns out to be class 2 modification 1 because there's only one extra additional edentulous area, and the most posterior is determining your classification. So this is class 2 modification 1. Now there are some examples which I'm going to show. Now as per this, I have not written what these classifications are. Now I'm going to explain it to you. Over here as you can see, teeth in A, there is teeth present anteriorly and posteriorly. So this turns out to be a class 3. B is edentulous area bilaterally on both the sides and it is posteriorly. So this turns out to be a class 1. Now again in 3, now again in diagram C, anteriorly and posteriorly teeth is present and it is not crossing the midline, so it turns out to be a class 3. Over here you're not seeing how many teeth are absent, like over here 2 teeth were absent, over here 3 are absent. You're not seeing that, you're just seeing your edentulous area, how big it is, like if there are teeth present anteriorly and posteriorly, or if there is teeth only present only anteriorly, you're just seeing that thing, only the edentulous area. Then this is edentulous area present anterior to your remaining natural teeth and it crosses the midline. As you can see, this crosses the midline, so it turns out to be your class 4. Now over here there are two edentulous areas. One is this and one is this. You're not seeing how many teeth, you're just seeing the edentulous area. So one is this area and one is this area. Now as per rule 5, the most posterior determines your classification. So your class, this is unilateral edentulous posteriorly present. So this is class 2 and there's only one more additional edentulous area. So this is modification 1. So you're writing it as class 2 modification 1. Now over here, this is class 2 modification 1 again. You're not seeing, because rule 5, firstly you have to concentrate which is the most posterior classification, that will determine your classification, or which is the most posterior edentulous area, that will determine your classification. So over here this is the most posterior edentulous area, most posterior edentulous area. Like over here there is teeth present, so the edentulous area is ahead of this present natural teeth. This won't determine your classification, as there is no teeth present behind this edentulous area, so this is determining your classification. So this is class 2 modification 1. Only one edentulous area is present, one more additional edentulous area is present, so this is modification 1. So this both are class 2 modification 1. Now over here, as you can see, there are 1, 2 and 3 areas, 3 edentulous areas. Now this is class 3, this is class 2. Now the most posterior again will determine the classification. So this is class 2 and there are additional 2 spaces, 2 additional edentulous areas. So this turns out to be class 2 modification 2 because there are 2 edentulous areas. So it is class 2 modification 2. And this one is your class 3 again, because anteriorly and posteriorly teeth are present. Over here, these two are the diagrams which you are going to say me in the comment section below, like which one is the above class and which one is the below one. So you are writing them. If you understood this Candice classification and the Applegate's rule well, then you can easily determine what these two casts they determine, like what these two casts are, like what the classification is. So these two classifications, you are writing the answer in the comment section below. I hope you understood this Kennedy's classification and you have any doubt regarding this classification or the Applegate's rule. So just comment down below your doubts. And the last part of the video is what are the merits and demerits. Like this classification, every classification have some pros and cons. So even this classification has merits are this is simple and universally accepted. It is clearly communicatable. You can easily communicate. It is easy to write to diagnose the condition of the oral cavity. Then it permits the visualization of the type of partially edentulous arches. Then classification is based upon the edentulous spaces. Then the number and location of the edentulous spaces can be identified, but does not indicate the number of missing teeth. Like you're not seeing how many missing teeth are present over here, like how many teeth are missing over there, but you're just seeing the edentulous areas. Then the classification, it provides design for each class. Demerits are it does not assess the choice, number, location, condition of the abutment teeth. Like you're not seeing how the abutments are over here. You're just seeing how the edentulous area is. Then the assessment of the hard and soft tissue status is not possible over here. It does not indicate the position of the individual teeth and does not permits the assessment of the occlusion. We cannot assess the occlusion in Kennedy's classification. So these are the merits and demerits. These are the components of your removable partial dentures. It is the components are connectors, retainers, and the denture base and the replacement teeth. So connectors are major connector, minor connector. Retainers are direct retainers, indirect retainer. Indirect retainer, there are reciprocal arm, retentive arm, rest. So all this component I'm going to cover one by one in my further videos. Like I'm going to cover direct retainers in one video, then indirect retainers in one video. Like I'm going to cover broadly every component of removal partial dentures, how they are made, and everything I'm going to cover in my further videos. So this was it of this video, and I hope you understood this video, and I hope you like now you are cleared with your Kennedy's classification, because that's the basis. Like you should diagnose your case well before giving any treatment. You should diagnose your case well, and your diagnosis should always be proper and accurate. And if you know your Kennedy's classification well and the Applegate's rule, then you can easily diagnose the case, like whether it is class 1, class 2, class 3, class 4, or whether there are some modifications and everything. You can easily classify, you can easily determine it. I hope this was helpful to you and you like this video, and if you did, then do like, comment those two cast answers, and if there are any doubts, and do share it. If you find this video helpful, then do share it with your friends so that it can be helpful for them too. And do subscribe to my channel, as I am going to explain everything, and like everything of your final year, even first, second, third years, easily, so that you can score good marks in your exams. And believe me, prosthodontics was my favorite subject when I was in final year, because prosthodontic is such subject, when you understand the concept well, then you can then prosthodontics, studying prosthodontics becomes too easy. And I'm going to make it very easy for you. I'm going to make prosto interesting and easy for you, believe me. So thank you so much for watching my video. Like, comment, and subscribe to my channel. Thank you so much.